that we are recording this session, and we are here to talk about Workshop Wizard and also the WellConnect program, and to talk about how the two might work together, differences, similarities. And so I will just frame it a little bit. The discussions we had had prior to this were about Workshop Wizard as a software as a service that's designed to help manage workshops, people, referrals, participant data, etc., and to manage the collection of data for multiple evidence-based programs. And then I'm going to switch over. This is the WellConnect site, which Nadia has been working with Erin on in terms of putting together this website, which is out of the Southeast Minnesota Partnership and is designed to be doing similar things, as well as some information, sort of a portal for participants. So the questions we had that we were generating were around where each of the software as a service products were in terms of development, whether there was any way for them to intersect. And so I think that was the starting point from my memory. Erin, you want to jump in?
Yep. Yeah, that's correct. I think the main issue that we need to understand is so the WellConnect site, Nadia can speak to this more technically, was really developed. It was not so much designed as a data collection and management tool, but more as a tool to engage participants and leaders and end users and stakeholders in using it, and hopefully scaling up workshop implementation in our region. Now we have, as started to work with Nora and Joan and the rest of the team at the state level. We realize there is a need to have this data management and reporting infrastructure, and there's interest in trying to understand if we can maintain sort of the look and feel and functionality that we have with our site, which we like, but still having the advantage of data management and reporting that Workshop Wizard offers. So I realize there's a lot of coding and programming that needs to happen for that to occur, and so I think what we're trying to understand here is the opportunity cost of figuring out that versus abandoning the functionality that we've developed in the WellConnect site, or just continuing to build the functionality that Workshop Wizard has. So I think those are things we're trying to understand. Nadia, do you want to maybe elaborate?
Yeah, absolutely. Yeah, and I think, yeah, correct. So just because we've got a few, technical folks on the line here as well, the WellConnect tool, it serves as a website, and it's really a web application in itself. So a lot of the data that you're seeing up front is being generated through the database. So, websites are normally very static, and somebody has to go update that information. If you have the right permissions, you can actually edit the data right there on the screen, and it saves it in the database. And so it's really a hybrid tool, if you will. Some of the functionalities that we have built and are 100% working is access control. So there are various different roles that people can be assigned to. One is an admin role, a leader role, web content role, and that's how we control a few things. For the leaders, we've got the ability to add a new workshop, add schedules around the workshop, add locations for the workshops themselves, so they can actually go in and select a location from a drop-down, and they can also click on manage locations, and they can manage the different venues and stuff. So that piece is all 100% complete. So as far as signing up for the workshop, that piece is also complete as well. So participants can go in and register for a workshop, and then the leaders can go in and look how many participants are signed up, who signed up. The leaders can also register people in the workshop themselves. So if somebody doesn't have access to the web application or a computer, leaders can go in and register them. As far as reporting and data collection, it would be interesting to hear what data points specifically are we interested in from a reporting standpoint. So that's, I think
we can definitely show you that.
Yeah,
Nadia, I have a question.
Yep.
Oh, so I'm on, as you can see, I'm on the site, and I'm not finding that any of are the links not live yet?
Yeah, so you don't have the permission right now,
okay,
because you're not set up as a leader.
Okay.
So yeah, so when a leader logs in, they will be able to click on that button.
Okay.
And I'm actually in the process of all the leaders I think have signed up, and I'm in the process of assigning them the leader role so that they can go in and start adding their workshops.
Okay. Well, what I think where we are, it seems to me, I mean, I can show you in terms of participants. Oops, I timed out. Let me try again. Harry, do you want to log in, or you want me to log in as me?
Why don't you log in as you?
Okay. I didn't know whether you had special powers that we needed for this. There we go. So I can show you, in terms of the participant data, what we collect, what's pre-programmed in here is the data points for the data points for the basic data that's collected and requested by the Administration for Community Living, which is taken through the National Council on Aging. And then what's also in here is some additional questions that people have wanted us to put in. And there's basic attendance. There's also the pre-diabetes test information that is used not only for the National Diabetes Prevention Program enrollments and referral tracking, but also is part of what's being used for some of the diabetes self-management education work, DSMT work. There's also the ability to edit these this survey information. So what you can do is add in pre-tests, post-tests, follow-ups, and you could also, on your own, add, for example, if you need to do a pre and a post of how long can you stand on one foot, for example, just to make up something wild. You can set that up yourself. So we have a number of different people who are tracking different kinds of things. So here's some, we have, for example, here are the basic pre-diabetes things, but we have people that are doing hypertension work. There's a leisure component people are doing. Some people are doing matter of balance. Some people are doing steady tool pre and post. So we have a lot of different folks that are doing a lot of other small research projects, that this allows them the capability of setting this themselves. And so that is what is here. Then there is an export and an import data function that's within here as well. And you had mentioned the access. So for us, the access happens through the People tab. And for example, let me see, let me search. Erin, I'm going to use you as an example because I just set you up.
Okay, I'm not logged on to a computer anywhere, so I don't see anything. But
I have I set you up as having full access, just so you know. Mm-hmm. So when you have a chance to get on, you'll be able to see it. But this is where we set up the access piece, Nadia, so that as we put a leader in the system, for example, we can set up whether they have no access, full access, or they can just view certain. And then we can also set up which data they can look at. And then these are all the different areas that are set. I think, though, I think, Harry, jump in, please. But I'm thinking what we really need to talk about is, in terms of functionality, whether it seems to me that we're going to need to talk about what pieces of Workshop Wizard can be used by the WellConnect site, and if there's a way to pull some of that through so that the functionality within Workshop Wizard can be used, and the appearance and the look of WellConnect can be used. And maybe we need to talk about which pieces and parts of that, because I'm concerned that there's enough things that are similar that we may be duplicating efforts, and and I'm not sure that is a successful thing for us to be doing.
Right.
If we both have the same data. So, Harry, do you want to talk about what you've pulled through before?
I'm not sure what you mean.
Well, what areas have you set up to pull through into public websites?
Oh, typically Workshop Wizard is not used by the general public, so it's intended to be used by either just the staff at an organization that's managing workshops, or perhaps also some leaders, but not the general public, so that if you add a new workshop in Workshop Wizard, you might have a different public website that is reading that database and letting people look for a class that they might want to take, for example.
But do you have like do you have web services built for that, or how does that work?
Well, we've been using iframes, but we could certainly put web services together for that if the need arose.
So what has happened is that then, so I guess one of the questions is, if we were to, would it work, Harry and Nadia, if we were to have the pieces that are designed for the public to be operating off a WellConnect system, and the pieces that are designed to be used by staff, leaders, etc., for those pieces to be generated and pulled through from Workshop Wizard? Is there enough distinction there that we would be able to make it work without getting in each other's way? And I don't know the answer. I'm just making up questions.
Yeah. I think that would be a question that we can probably take back, and Dr. Lupina and I can kind of talk through that from a functionality standpoint, because right now, what we have done, like again, I said, we went with a web application because it is more scalable, and it was a lot more expensive to build things like calling a web service or, you know, maintaining a static website, but build dynamic pieces into it, which would have been a lot more expensive long term and even short term. So the cheaper option was to go with a web application because the functionality needed was more dynamic rather than static. So now, having said that, if we change strategy a little bit and say, all right, you know, we're going to be pulling the workshop information from somewhere else, and that the strategy that we were going with, which was 80% of the work, then we have to kind of rip out the infrastructure that we have and really go with a true website and put in the work to make it dynamic. And whether we use web services to pull the data, I think iframe might be a lot more cheaper than trying to write code in a static website to call web services to interface. So, I mean, those, you know, the cost kind of ties right away into the functionality and the strategy, I suppose. So I think it requires a little bit more discussion.
I mean, just as an aside, so our implementation strategy is really one of engaging the public in partnering with the health systems to provide these programs. And so we really wanted people. So I just got out of a meeting where we're planning this big public, kind of media campaign that's going to direct everyone to this website to sign up for workshops and to refer patients. And I need to know, we kind of have to know for sure if this URL is going to be legit and how the functionality is going to work before we would move forward with that. But we're thinking, to scale it up, we want to sort of give some of the onus to the community to actually, register their own workshops and have them available. And I would hate to lose that functionality, which, if I understand, would need to happen if we kind of reverted. But
yeah,
is that correct?
Yeah, that is correct. So, yeah. So the workshop functionality would, the way I understand it, would have to move into Workshop Wizard, and so then that's kind of the basic foundation functionality. Then the Find a Workshop Near Me functionality also goes away because that data is now living in another system. So from WellConnect, we'll have to take that functionality out. We'll have to take the, like I said, 80% of the functionality that we've built in WellConnect would have to be stripped out. And then whatever is going to be left is going to be just the website. And then, from that standpoint, it doesn't make sense to have the infrastructure and pay for that infrastructure to host just static content. Then we might as well go with a, cheaper option. There are lots of other good tools out there that you can build a website off of and not have a web application infrastructure. So,
well, and I think
that makes sense.
I hear what you're saying, and I think one of the questions is I honestly have, I know what our software as a service, what the cost is, and I know sort of basic starting prices on what a simple website would cost. What you all are building with WellConnect is not a simple website, and I get that. But I also, I don't know where you all are in the design, development, coding, how much is already involved in that. We have been assuming also that we want to have one system where, we have people entering things like workshops in one place. Maybe that's not to do. Maybe we have, maybe there are two different, maybe you all are going to use the WellConnect system, and in the other parts of the state, they're going to be using Workshop Wizard, and you have two different reporting source, or two different sets of data going to the national folks. I mean, I don't know. I've been assuming we're talking about how do we sort of not combine them, but how do we use pieces and parts from both in one place. Maybe that's not the right approach.
Mm-hmm.
I don't know. Harry or Aaron, do you have thoughts on that?
I'm curious about how far away from having WellConnect ready to be used you are.
So I think the 100% functionality really depends on what you consider 100%, right? So like I mentioned earlier, that being able to add a new workshop, being able to look for a workshop near you, all the access control piece of it, being able to add venues, those pieces are all 100% complete working today. And we use Agile process. I don't know if you're familiar with that or not. So we take small functionalities and we build those out. And so we're building basic pieces as we go along. And it's not live yet in the sense that we haven't rolled it out to the community yet. I'm not exactly sure. That's more of an Aaron and Lori question of when we will be doing that. But I think there's a lot of strategy pieces that need to be figured out before we can roll it out to folks.
Yeah, I mean, the rollout, what's holding that up is confirming that we kind of held things, because when we understood that the state was going to invest in a statewide infrastructure, that we needed to figure out the implications of that for WellConnect, so we kind of held there. We are working with some design folks to really, add a little more content and just tweak some of the visual graphics and stuff like that. But but beyond that, there's not really we could go this summer, I think, go live, and we've trained the leaders on how to register their workshops and load them up and that sort of thing. But none of that's collecting or reporting data, and so the way we would do that currently is that would all be done manually. The way it's currently done, our AAA would upload the data manually to the databases that are required if we went live with that today. Now, I don't think different systems for the state is probably it's not an ideal long-term solution, and I think what would be an ideal long-term solution for my understanding for the state of Minnesota is having sort of each region having sort of their own version of WellConnect that all behind the scenes is integrated and managed at the state, that collects and manages all the data. But we would really be interested in engaging locally each region and sort of creating their own system, even their own URL that they can identify with, and get behind. Now that time frame for that, and I haven't really even discussed that in detail with Nadia about the feasibility of that, but that would be, from my perspective, an ideal kind of long-term vision. And I don't know how.
Are you thinking that you would, because I have up on the screen, I know you can't see it, but I wanted to just, a good chunk of how we built Workshop Wizard was to be able to handle the participant information. So the data that's being collected, as well as leader certifications, trainings, et cetera, for multiple evidence-based programs, but also to handle all of that participant data. We do it for the state of Colorado. We've helped the other states that we work with set it up for statewide data. So if you are you hoping that WellConnect is also going to handle the participant data and then upload it to the NCOA? Would that piece be something that would be handled on like a statewide one-stop kind of, where all the data gets sent into one place, or is that still up for discussion?
That would depend on what the state needs and desire. I would assume they would want us to submit their data to them so they could send it up, and that would be, I'm speaking on behalf of our area agency and aging, but I'm sure that would be fine. I don't think it makes a lot of sense for one region to kind of go off on its own and submit directly to. But I don't know. That's a discussion we'd have to have with other folks outside of Southeast Minnesota.
So in theory, Workshop Wizard could be a statewide tool that would track participant data and allow for reporting, whether it was to the NCOA or Project Enhance or the Center for Disease Control, wherever the evidence-based reports needed to go for those curriculums. In theory, it could do that behind the scenes work and be the repository of the other information, like the workshops and all that kind of stuff, for the other parts of the state. And then the information could pull through from Workshop Wizard into websites other than the WellConnect, because at WellConnect you already have those capabilities and are already ready to go with the workshops and with the leader capabilities and all those other pieces.
Can I mention something? It's Nora. Is that okay?
Sure.
It's just that through this Cargill grant, the $3 million 3-year grant we have, it has a setup where the MAAA is the association we're the managing organization, and so the MAAA is supposed to be managing for the other AAAs. So that, let me put that out there. But then we do have, Lindsay, we're looking at what Aaron's talking about, we're looking at this community organizing model, where it would strengthen our AAAs, and they've done that obviously in Southeast Minnesota, if everybody could, really organize and have sort of their control over their, like I said, separate URLs and those types of things. But ultimately, for us, this is a sustainability strategy. We would be, maybe, I don't know, Aaron, if we talked about this, but we'd be charging and we'd be making money, or what I was also say that off the website. I mean, that's part of, it'll be part of MAAA's responsibility, and that's the way the grant is written, and we take that seriously just because that grant is to help us and the other AAAs be sustainable. Does that make sense? Anybody there?
Yeah, I'm not sure. Yeah.
So it's hard for us to. So we need a lot of the stuff to. We're envisioning it kind of going through us, and I don't know if there's a way of it to go through us and still have people be separate.
Yeah, and I don't either. And I guess to me, that's the big question, because you know, I know we have the capability today of the Workshop Wizard work, and I know we have the capability to pull through information into multiple URLs, so that each part of the state or each AAA could, you know, could have all of the workshop information, or just those workshops in their region, or however we decide to do that. So I get what you and I have talked about, Nora, and what's possible from Workshop Wizard's point of view. The question to me comes with what Erin and Nadia are doing with WellConnect, and how we can be supportive or collaborative, and I don't have a good answer.
So let's say in theory, and this is totally hypothetical, that statewide we went with Workshop Wizard, and it sort of functioned as you're saying, with each region, you know, having their own public website, at least initially, and then simultaneously with that, we just really don't really use it, at least not in Southeast Minnesota, don't really emphasize it, and just do everything through WellConnect as we plan. What are the additional things that what's the additional work required to take what we have and put it into Workshop Wizard behind the scenes, even if it was, I mean, is it a manual and intensive process, or what would that look like?
Assuming that we're not talking about a programming import, assuming that we're talking about, I mean, I don't know how many classes you all, or workshop series you all are doing in a given year, but what it would mean would be entering the workshops or trainings. So whoever is the administrator, whether it's Nora or somebody on the staff up there, would give you a user ID, a login. Someone on staff would go in and would enter the information in terms of the site and the organization and where the workshop's going to be held, what data needed to be collected, and who was leading the classes. And then it would be within the Workshop Wizard, and could also then show on whatever websites it was decided the information from the Southeast was going to show. So if there's for example, one statewide website that's promoting everything that's going on in the state, it might show up there, but it might not show up in a local website that only lists things in the far northwest corner of the state or something. Mm-hmm. But so it would be a manual process of entering the information. Now,
I mean, my understanding is right now that's what we're doing anyway, is we're manually submitting that data. Lori has piles of papers where she just types the stuff into databases. So, I mean, that's not an ideal scenario, and I think Workshop Wizard kind of helps get rid of some of that. But
yeah, and I think
we're doing that too. Yeah.
And that's for the participant data. I think is what you're talking about that Lori's dealing with from the AAA. What would have to happen if you wanted the workshops listed and the leader trainings and things, then they would need to be entered both in WellConnect and they'd need to be entered in WellConnect.
So for our workshops in Southeast Minnesota to be seen on the state sites or anything, it would need to be entered into Workshop Wizard. But if we feel confident that our target audience can see everything that we need them to see through the WellConnect site, then it really doesn't matter too much, does it?
The only thing that would matter, and Nora, this is really your come from on this. My thought is, in Colorado, we've really worked to try and get everything in one place, so that when we need to take a look at data statewide, or when funders want to take a look at anything statewide, we have the capability of doing that. And if we don't have the information on workshops and leaders, it's then harder to put together really good quality participant data.
Yeah, I do think that the Department of Health and the Department of Human Services and the Board on Aging would not be happy with one region not being different than all the others, and how would they get that data? And just like you said, Lindsay, do comparisons or uptakes or growth, or right, to try to compare statistics. So you wouldn't get we wouldn't have statewide, we wouldn't have the ability to do statewide if you guys did your own, right?
I got a thought, and Harry, tell me if this is stupid, or shall I say crazy. If WellConnect if leaders are entering the workshop information, not the participant information, but the workshop information into WellConnect, could we program or work with Nadia on programming an import from WellConnect or from the southeast part of the state that could be then imported into Nora's Workshop Wizard?
Yeah, that's certainly possible. And while, as a general rule, I hate to have the same data stored in two different places, it's certainly better to have it automatically move between those two places. If you're going to have two of them, the last thing you want is to be manually typing it in twice. So if you type it in one place, then have it automatically copied to the other.
So then the participant data could all be entered into Workshop Wizard in the same fashion it is now, whether that's done through one location or whether each of the AAAs have a login and do participant data. That in essence wouldn't vary. But what would be different is if you were using WellConnect, your leaders could still input the data for the workshops and the trainings into WellConnect, and then WellConnect would send that information to Workshop Wizard. So you would be, in essence, doing your own thing and sharing your own thing with Nora and the statewide system.
Yeah, we just need to make sure that our forms match the data elements that Workshop Wizard uses.
Yeah.
Right. And the interfacing piece as well. So if you guys have web services built, Harry, we can just call those web services, and as the leaders are submitting these or entering the data, as soon as they hit submit for a new workshop, we call the web service and the data gets entered in Workshop Wizard.
Yeah.
So Nora, would that work from your perspective?
It's a little bit, I guess I'm a little bit, maybe I don't fully understand, Erin and Nadia, so you just would, and Lindsay, this is a little bit awkward, I don't know how to say this, but you just don't want to use Workshop Wizard, or you feel like you already have the same capabilities, or what's the, or you just don't think of that, so it's hard for me to understand why we'd need the two different systems, or we can talk another time if you like.
Yeah. I think just
don't worry about it.
Yeah, okay. I think just the systems were designed for different purposes, and they both, I think, do what they're designed to do well. I mean, we designed this to really facilitate and work with this sort of community organizing approach that we've taken, and so that the community, the leaders upload their own workshops and that sort of thing. That doesn't happen through the Workshop Wizard system. And so we would sort of have to undo our philosophy. I mean, I don't know if that makes sense.
Yeah. So it's a more grassroots, right?
Yep.
Yeah.
Yeah. And although we have partners where the leaders do their own entering of their own workshops, and it has certainly been used that way. but the whole design and the whole look of the system is not focused on that, which I think WellConnect is really focused on the leaders, the providers, everybody's on the home page together, and so it definitely has a different feel to it, and it has a definite it's a really pretty website, I have to say. It's very pretty.
Yeah. Well, I think so. Yeah, I guess I'll, this wasn't really my call here, so I don't want to dominate it all. But I just think that that's something we'll have to, for the state. And honestly, I think you both know that things at the state are uncertain. I know, Lindsay, they keep taking the next steps where they're doing things. So we're hopeful, but we don't know where they stand. And our understanding is DHS may jump and buy something. They have money, just like the grant has money, and so we're kind of worried we might be headed for a uncertain adventure here too, because we don't know what they're going to do, right? And they could, do you have any? Where are they at, Lindsay? Is the state kind of, are they
I think they like what I'm hearing on the call today are confused. Maybe confused is the wrong word. But they're wanting to have centralization, they're wanting to have access, they're wanting to have all the great things that you all want to have, and the question is how to do it, and who's already doing it, and how to get everybody on the same playing field, out of silos and into the same playing field. And so I think what I heard was a lot of interest, a lot of excitement about what was possible, and just still trying to figure out how to make that work.
Yeah, that's kind of where we're at. I mean, unfortunately in Minnesota there's some mistrust between the state agencies and the AAAs, and they've always been, it's like a parent-child relationship. They've been the parent, and I guess we've been the children, and in other states it's not like that, right? And so it's an unfortunate way they're viewing the relationship. Yeah.
I think it's that way in every state to a certain extent, and then there's then the kids become teenagers, and
yeah.
everything changes. So yeah. So I think that until there's still big question marks about what the state is wanting to do. Clearly, WellConnect already has something in the works, and has plans to promote it, and it sounds like the software, the website close to done, if not done, and I think that's kind of like a given at this point. And so then I also hear what Nora's saying about the work they want to do, and so I guess my best thought would be, rather than trying to pull things through from Workshop Wizard into WellConnect, I guess my best guess is the way to do that would be to have WellConnect import back to Workshop Wizard what you all need for the statewide efforts and the statewide reporting.
Okay. Yeah, that's okay. I'll sort of take it back to
an either or.
So maybe as a next step, Harry, would it be possible for you and Nadia just to have a sense of how much time and how challenging it would be to actually make those connections, to send the workshop information to Workshop Wizard, just to get a feasibility estimate on that?
Yeah, we could certainly do that.
Maybe it's not a big deal, but
absolutely.
On that work, I know with at least one other state, but I think it depends on the programming on both sides, right?
Mm-hmm.
Yeah.
Yeah. Yeah, I think for us it's going to be depending on what data fields you require on Workshop Wizard side of things. We'll just have to either create those additional fields and then send that data over. And then obviously there's going to be a training piece involved as well, training the leaders to enter the data and what needs to be entered and making sure that required fields are marked as required. And then on Harry's side of things, I'm thinking you don't have the endpoints for the web services, so you'll probably have to create those that we can call.
I agree.
So you guys could maybe email offline and come up with a guesstimate?
Yeah, absolutely.
I think so, yeah.
So that would at least give you the information, Erin, and give you information, Nora, on at least this version of things.
Mm-hmm.
Yeah, exactly. Sort of the cost and the hours involved and that type of thing. Yeah, that would be good to know.
And kind of what it would look like. So then, you know, we'd know kind of what WellConnect was doing, what Workshop Wizard was doing, and then based on what the state's thinking, we could go from there.
I think we're meeting with them next week, and then we're meeting with them in another 2 weeks. And the thought is, you know, so we have about 3 weeks when they'll start to firm things up if everything's going well, you know, and they don't jump or something. But so I think that time, do you think that timing might work on your end to talk with Nadia, and for Harry and Nadia to talk? That gives like 2.5, 3 weeks.
Yeah.
I think so.
So.
Yeah, they both sound like they don't talk as much as I do. And so they probably will have a very quick meeting as opposed to so
they can just type to each other or something and
I'll just IM. You're in Google Hangouts.
Right? Am I wrong? I mean, you know, they'll like, if they were in the same room, they just nod at each other and they'd get it. So they have their own languages, is so that they can do it without as much time. It's very, very interesting. Okay, so then I guess the information then Nora, I would want to ask you about is if everything that we are asking within setting up workshops, which you can see on the Workshop Wizard, just what all we ask them to put in when they're setting up a workshop, if that is all information that you want from the WellConnect site, because that would give us the data points.
Okay. So would I get those from WellConnect, or I would get them from? I'm on the.
I want to look at Workshop Wizard.
Yeah, I'm on your. Okay. So I need to get in there and okay.
Yeah, if you look, I don't know if you're logged in now to see the screen, but
I am. Yeah.
Okay, so on your screen, I think you will be able to see I've got workshops and trainings highlighted.
Yeah. Yes.
So if you click on there, this is the tab for setting up workshops and trainings. So there is all the general information, which includes the license holder, which curriculum it is, if it's connected to a health system, et cetera, et cetera. And then there's also who's leading it, and also paperwork, you know, which of these pieces, including are you using, which surveys are you using, what the funding, you know, there's a lot of information in here, and how many of those data fields and points you want to have WellConnect send over, and how many are the ones that are the bare bones ones. Like I know they're going to want to know at ACL what the curriculum is, what the site is, and so some of those are the ones that will have to be there because that's part of what you report back. But there may be other things in here that you want to track as well on a statewide level.
Yeah, we honestly we may want most of those
Okay.
because I know the surveys are tied in with research, right? And I mean, I doubt we'd want to eliminate anything. I don't know, but I can talk to the state about that too. But I think we'd want, for the longer term, we'd want to keep those things intact, right?
Okay.
And that's my current thinking. Because you showed me that survey stuff at one point.
Yeah, I think, but I think, and then, you know, what language, what funding source, that may be stuff that
I see.
that would be helpful for you all at the state level to have. But that, even if we decide all of this is necessary and we have the proposal that Nadia and Harry are going to work on, even if they look at it using all of these data points, that at least gives us a starting place.
Okay. Yes. So I should take a look at it and, yeah, tell me the next steps. I'm listening.
And I imagine that we're talking about having WellConnect gather not just workshop and training information, but also organization and site information.
Yes.
Yeah.
Yep, yeah. It's set up that way today behind the scenes.
Yeah. Because that also is what you're going to need to report. So, and that ties back within Workshop Wizard too. It's which organization is hosting it at which site. So,
Yep.
yeah. Okay.
What about referrals? Would that be a WellConnect thing or a Workshop Wizard thing or both?
Well,
So
we're interested in it. Yeah.
yeah, if you switch back to WellConnect, I think that piece is open to public. If you go back to the WellConnect tab, if I remember right, I think if you click on providers and then click on start referral.
Mm-hmm.
So they
you
can refer a patient,
Mm-hmm.
and then it's going on a secure site. It's a
Yeah, so this is all secure. Right now you're running off of a HIPAA compliant cloud instance. So yeah, if you put in a patient in here and you put in the referral, it goes into an intake queue, and then whoever's monitoring that intake queue will either assign them a workshop or contact them via email. Or so there's that additional notes piece. They were thinking of utilizing that additional notes piece either if people were interested in registering for a class or workshop, or if they were just thinking about it and just wanted to talk to somebody. So there's a staging queue, if you will, for people. So that's one piece. And then so that piece is all complete. I think if you go under find a workshop, I think you should be able to register for a class as well or a workshop.
okay.
But so to answer your question, Harry, the referral piece is built.
And I think how we have a little bit different system in that we set up the referrals based on health system referring entities and then referring individuals within that, and then the referrals themselves are there's a search thing, so you can search for people who have enrolled in classes, people who are due a call back. And then there's also the information we collect and then the contact management piece. And then I think one of the things that we have that may be of of interest is that we have the ability to then generate reports that can go back to the referring practice. And these that would give which entity it was, and you can pull them up by entity or even referring person within the health system, get the participant address, calls that have been, and then any notes, whether they,
Sure.
yeah, and so we have that piece. So I think that then the question becomes one for Nora of, is that something that on a statewide level, you know, you can assign handlers from multiple locations. So then the question is this another area where WellConnect could operate independently, but the rest of the state could work with Workshop Wizard? And do you necessarily need or want the referrals from WellConnect to go to the state system?
I don't think we have to, although we're trying to kind of track referrals. You know, that's considered sort of that's a statistic you want to build on, right? And so I think that the state might be interested in, you know, if for example, we have more referrals than we do, and why, and what you're doing well, and, you know, all that kind of stuff.
Yeah, my sense on that is that, you know, WellConnect can just do that internally and then give you the data, and that would probably be just as simple.
Okay.
May save if we were gonna, if we ended up going that route. I mean, it would.
Yeah.
But I don't know.
And then the other thing that I remembered from the sessions that we had, they didn't want people logging into a tool to do a referral because that just created another extra step for them. So they wanted the referral piece to be really easy and easy to get to, so that we can start removing any blockers from that standpoint.
Mm-hmm.
Yeah, and I know we on our public website have, you know, they can either send it to us through secure email, or there's a form right there which is similar to what you have on WellConnect that's just asking for the basic information and then gets sent to us. And we have some folks that are doing it once they're used to it, they're doing it through their EMR, so that, you know, once a physician has it, then they just program it into their EMR, and then they don't even have to visit WellConnect or Workshop Wizard or COA or anybody, and they can just do it directly. So, yeah, I think I agree with you. Whatever makes it easiest for the referral.
Okay.
So it sounds like next steps are Nadia and Harry are going to get together, and we'll come up with some ideas of costs, and we'll send that out to everybody, assuming that this may be an option, and so we'll send it out as an option, and then Nora's going to talk to the state, and I know Erin's talking to folks, and then y'all are going to talk with us and let us know what we can do from COA and Workshop Wizard, kind of where we're at and what you need from us.
Yep. I think that makes sense. I saw Brittany just thank you for her password, so I know they're starting to go into the site and look at it in more detail. So I think things are coming together, and we appreciate all the time. I feel like we're taking a lot of your time, Lindsay, but this is we have a lot of partners, and that's good. Right?
No, it's been really interesting to work through it with you all, and yeah, it's our pleasure. And so we will, and I will send you all the link to this recording as soon as we're finished, and we'll just keep talking.
Yeah, I think that's the best thing.
I mean, Nadia and Harry may not talk, but the rest of us will talk.
I think we're being ganged up on, Nadia.
I think so too. I think we should talk more.
Well, yes, I'm just teasing you guys, but I just think you guys, because you're the ones that have made all this possible, Harry and Nadia. If it wasn't for the work you guys have already done, none of us would have anything to talk about. So, I mean, we are talking websites here, and you guys built them. So, so thank you for that. And I guess we are finished for today, unless there's anything else.
I think that's good. I want to echo Nora's comments that you guys have been very gracious, and we appreciate all of your thoughts, feedback, and help.
Yeah,
our pleasure. Really, it's been very interesting, and I thank you for making time within everybody's schedule to do this. This is terrific. So, and our fingers are crossed. We still would love to
Likewise.
guys. So,
yeah.
Okay, sounds good. Thanks.
Okay.
Thanks,
Bye-bye.
everybody.
Everyone.
Yeah, bye.
Bye.